is loud and clear about what's taking place in Washington, D.C. As we speak, our United States Senate is considering passing what we have described as the big, ugly bill, something that we should not be thinking about passing in Washington, D.C., given its impact on the people of Pennsylvania and across this country. Our focus has been providing care, not cuts, and that's what this legislation is going to do. It's going to provide tremendous cuts to organizations and programs and services across this country that will have draconian cuts here to Pennsylvania and mean-spirited things that would take place along those lines. I'm joined by my colleagues who are here today, a number of them, to want to make certain that anybody's within the sound of our voices, who's able to watch this on television some way, that we take steps to be able to activate them, to get them to speak with their congressperson and contact our U.S. senators to ensure that they vote against this big, ugly bill. What does it mean to the people of Pennsylvania? It means a variety of things. When you stop and think about the services that are provided through our Medicare program, programs through the Medicaid program, all going to be in jeopardy. Our SNAP program, our CHIP program. You stop and think about many of the other farmers market programs along those lines and the impact it's going to have on the quality of life of so many people. And these are not going to just be one-year changes. These are going to be changes that are going to be in place for many years to come. Many years to come, and we need to recognize that. And certainly we need to know what the impact's going to be on our general fund appropriations as we're here on June 30th trying to close out our budget situation here in Pennsylvania. So I'm here today with our colleagues to say, please people, listen and wake up and recognize what's taking place and take steps to be able to stop it. My colleague, Senator Vincent Hughes, our appropriations chairperson, will go into detail about some of the programs, but we want to say thank you for being here and thank you for listening, and hopefully you take our advice and be able to reach out to your senators and your congresspeople to be able to ensure that they defeat this proposal as we now know it in Washington, D.C. Senator Hughes.
Thank you, Senator Costa. My staff has provided me pages and pages of numbers and details that talks about what is being discussed, what is being advocated for in the big, ugly bill. There's nothing beautiful about what is being discussed in Washington, D.C. It is ugly, it is hurtful, it is painful. It hurts every person in the Commonwealth of Pennsylvania, in all corners of the Commonwealth, whether you're in rural Pennsylvania or urban Pennsylvania or suburban Pennsylvania. No matter where you are, you will be hurt by what is happening in Washington, D.C. And the cruelest thing, and maybe not the cruelest thing, but maybe the surprising thing, is that the people who are voting for this represent the people who will most be harmed by it. And they still vote for that. That is those rural representatives across Pennsylvania. But it's even heartless for those in the United States Senate to be even considering the hell that will rain down on the people of Pennsylvania and the people across this nation. How do we have a conversation talking about reducing health care for people, cutting health care for people, and in Pennsylvania, close to 600,000 people will lose health care coverage? How do we have that conversation at this moment in time when we are the richest country in the history of the world? How do we have that conversation? How do we have a conversation about cutting food supports for seniors, for working folks, for our children? How do we have that conversation when we really should be talking about how we expand food supports for people, not cutting them, not reducing them? How do we have a conversation, a real policy conversation, that could be implemented before the 4th of July? How do we have the conversation that says to our young people who are going to college that, you know what, it's going to be more expensive for you to go to college than less expensive for you to go to college? How do we have a policy conversation that working people across this nation will be hurt? From service workers to folks who work in communities, to our building and trades friends. The National Building and Trades Union just came out against this just today. How do we have that conversation? Where are we as a people? Who are we? This is not who we are as Pennsylvanians. This is not who we are as American citizens. We are better than this. This is so bad that even Fox News polling Fox News polling. Fox News polling says it's underwater double digits. Every polling, every research organization says this is bad public policy. This is the wrong way to go. The only people who are being served by this is the richest of the rich. Those billionaires who are already receiving huge tax benefits will get that tax benefit extended for years and years and years. So our message to people right now, we as Senate Democrats are sending a message to people right now that it is not too late. You can still make a phone call. You can still reach out to your senator, 202-224-3121. For somehow I have this number memorized. Malone, I got it memorized now. Or you can call your congressperson, 202-225-3121. You can let them all know that this is the wrong way to go. This will be the largest change, the most dramatic change in recent United States history. Ever since the creation of Medicare and Medicaid, ever since the creation of Social Security, ever since those great programs came into place that made life better for millions of people across this country, we are now confronted with a return to a time that did not help all people. We're now returned to a time that is going to hurt people, not help people. Please, please, we implore you as leaders, reach out to your congressperson, reach out to your United States Senator. Let them know that this is unacceptable, and we cannot have this as the law of the land, and we certainly cannot have it as the law of the Commonwealth of Pennsylvania. I'll bring up now Senator Maria Collette. Senator Collette.
Good afternoon, everyone. My name's Maria Collette, and I am proud to represent parts of Montgomery County in the 12th Senate District. You know, as budget negotiations continue here in Harrisburg, we're reminded how the legislation we introduce really does represent our priorities. We often refer to our state budget as a moral document, showing Pennsylvanians what we value and what we don't. And while we're hard at work here trying to pass a budget that puts our money where our mouths are, senators in Washington are debating a disastrous bill that will decide whether some folks can purchase food or afford to visit their doctor. Should Trump's big bill succeed, the effects would be devastating to the lives of millions of Pennsylvanians, particularly our rapidly growing aging population who is already vulnerable to financial and health-related hardships. We aren't fooled by talking heads who say this bill is all about eliminating the unfounded claims of waste, fraud, and abuse. We're sticking to the facts. Take it from a nurse who worked in hospitals and nursing home settings. Healthcare for our low-income and aging neighbors in Pennsylvania is not waste. Quality care should be accessible to every one of us, not just the wealthy few. The people who would be impacted most by this bill are hardworking Pennsylvania families who are already struggling to make ends meet. They're older Pennsylvanians who rely on Medicaid to keep a roof over their heads and SNAP to keep food in their pantries. Following the devastation of the COVID-19 pandemic, the ongoing nursing shortages and closures caused by private equity greed, Pennsylvania's nursing homes are already forced to make difficult decisions to stay afloat and provide quality care for a growing aging population. Now, Republicans want to deliver another devastating blow by stripping away vital Medicaid funding, the very lifeline that supports nearly 2/3 of nursing home care in Pennsylvania. Let's be clear, our Commonwealth cannot afford to pick up the tab should those funds disappear, nor can any other state. Vulnerable people like our elderly loved ones will pay the price for Republican irresponsibility and billionaires' greed. And while our constituents' lives and livelihoods are put on the chopping block, please don't worry about the folks here in Harrisburg or in Washington. Lawmakers are sure to keep our generous taxpayer-funded insurance benefits. As the Democratic chair of the Senate Aging and Youth Committee, as a nurse and as a human being, I refuse to stay silent as we watch far-right politicians attempt the largest cut to health care in American history. Also, the richest 1% of Americans can receive $138 billion in tax cuts. My constituents have been contacting me for months, asking for me and my colleagues to stand up to the chaos they see in Washington, to stand up for their health care access and their ability to afford day-to-day expenses. It's time to hold these Republicans accountable. If this bill passes, the resulting healthcare system collapse will be their legacy. When hospitals and nursing homes across Pennsylvania are forced to close their doors, when seniors can no longer access care, when families must choose between medicine and meals, remember who made these cruel choices: the Republicans who wrote and voted for this catastrophic legislation. And while I don't have a direct vote in Washington, I promise to be your voice here in Harrisburg. Everyone gathered here today stands united against this assault on health care. We will fight for you, we will stand with you, and we will not back down. And when the time comes to fix the mess that these reckless Republicans are creating, we'll be here to make a system that works better for Pennsylvanians, because government should be about serving us all, not just the rich few. It's my pleasure now to introduce my colleague and our chair in our Health and Human Services Committee here in the Senate, Senator Art Haywood.
All right.
George is 22 years old. His mother describes him as a bright light in the world. And if you meet him, you would know him through his playful smile, his eye gaze, doing high fives with him, and him working on his DJ skills on his iPad. George has autism and an intellectual disability. He needs daily care, including bathing, dressing, and support for eating. George needs 24-hour, 365-day care. It is Medicaid that allows him to live in a house with 2 roommates and to attend a day program where his education continues. It is Medicaid. His mom passionately describes on him, she describes her son's story saying, George's life has as much meaning as any of ours. Every person with a disability should have access to Medicaid to receive the care and support that they require. She continues, I know that only a few generations ago, George would have been placed in an institution where he would have likely experienced abuse and neglect. Why would a human society ever consider returning to those days? She asked. So our fight to protect Medicaid, to affirm the right to protect the dignity of everyone, is for people like George. I have a number of other stories to tell, but in the interest of time, I will not. But I do want to move on to the question that Senator Hughes raised, which I understood to be, how are we in this crisis? Why are we considering these questions? We have proposals for work requirements for Medicaid. I don't know if you all know, but that's like doing your tax return twice a year. Twice a year, every 6 months would be the expectation. And our department, as fantastic as it is, Health and Human Services is not prepared to process these requirements twice a year, which means the reportings that will be submitted or not submitted, answers will be delayed, and individuals will be cut off from this expectation. Why would we do such a thing? For the ACA, individuals will not be able to afford the health care plans that are currently available. Now, I know some people have said everybody's going to be affected, but let me be more clear. If you live in a hospital that's not receiving reimbursement for the care, then that hospital is going to be threatened and subject to close. And when you go to the emergency room, that line is going to be longer because people don't have health care in their primary care locations. When it's time to get your insurance and your insurance premiums go up, which way they will do, because insurance is about spreading costs. And when we don't have the government paying their share of the cost, then who's going to pay? You and I, all of our neighbors. Why is the question? Senator Tillis from North Carolina answered that question. He said, I got a significant part of my population that's receiving Medicaid. I am voting no. That is the same situation as our Senator McCormick and Senator Fetterman. Our populations are not dramatically different than North Carolina. So my answer, Senator Hughes, is we are in this challenge because of a refusal to follow one of the most fundamental principles of our shared faith. And that is, what you do to the least of these, you do to the Almighty. They have refused that principle, and they have chosen moral bankruptcy, which is why we all stand here today. We know we can't let this stand for our neighbors, and so I join Senator Hughes and all of us in the call your U.S. senators and congresspeople today. Turn it over back to my good friend, Senator Costa.
Thank you very much, my colleagues. As we build upon the theme with respect to the impact it's going to have on health care and insurance, I think it's appropriate for our insurance chairman, Senator Sheree Street, to come up and say a few words about the impact it's going to have on the health care insurance industry.
Thank you, Mr. Chairman. The cuts that are coming out of Washington or that are proposed are unconscionable. Medicaid is the health insurance for so many of the most vulnerable folks in our community. The disabled, as Senator Haywood talked about. Folks, the extensive services that many people in the disabled community need in order to live productive lives are paid by Medicaid. Medicaid is the insurer for our senior citizens when they reach nursing home age, because no matter how hard you've worked your entire life, the reality is because of the escalating costs of health care when you get older, there are very few of us that won't need to rely on Medicaid insurance to stay in a nursing home after you've paid into the system your entire life. There are folks who are working their entire life. In Pennsylvania, there are 700,000 working people who, through Medicaid expansion, need Medicaid in order to have health insurance. Those are people who get up every day, but they're low-wage workers, many of them gig workers, some of them people who don't have employer-sponsored health insurance, but it's not because they're unemployed. Those people, a lot of whom live in my district, but a lot of whom live in rural Pennsylvania and small-town Pennsylvania, many of whom voted for Republicans in rural and small towns, many of whom voted for the president, and now he's betraying the trust they placed in him because his first act is to cut off their insurance and devastate their lives. He is devastating the lives of people in the inner city. He will devastate the lives of people in small town communities. Cutting Medicaid is irresponsible. It's wrong. There are so many other groups of folks who rely on Medicaid for their insurance. It is the insurance policy for folks who need it most. Whether you're a low-age worker, whether you're unemployed, whether you're the disabled, those folks all need Medicaid. And why are we doing it? We're doing it because he wants to give tax cuts to billionaires. We need to say no to that. We need to make sure that we continue to fund the health care of ordinary Pennsylvanians, working, disabled, older people. We need to do it because, as it's been stated, the budgets are a moral document, and it's immoral not to take care of those who need us most. Tell your members of Congress and your U.S. senators to vote no on the big ugly bill.
Thank you very much, Senator Street. Now, if anybody has any questions for us. Any questions for anyone? Well, let me say thank you all very much for being here today to amplify our message of the unified message from Senate Democrats that we stand and asking everyone to join us, join our colleagues in the House Democratic Caucus as well, and to encourage our Senate Republican and House Republicans colleagues here in Harrisburg to ensure that they reach out as well and they stand shoulder to shoulder, lock arms with us to say no to what's taking place today as we speak in Washington, D.C. And as they move forward in the next round of these type of votes, how imperative it is that they all say no. So thank all of you for being here. We appreciate the opportunity to be able to convey our message to all of you. Thank you.
Thank you.
All right.